fat and cellulite are areas that I think are tremendously misunderstood by patients, and I think a lot of that is fed by misinformation from the media. In fact, treatments for fat and cellulite are very different. And I think, let's talk about cellulite first. Cellulite is a phenomenon that is a normal part of being a grown woman. It has nothing to do with being sick. It doesn't have anything to do with someone being overweight. In fact, weight has very little to do with cellulite. Cellulite is something that occurs in all women after they go through puberty, and it is a completely normal state. Unfortunately, our media tells us that through pictures and magazines that it has to do with overeating and poor dieting, and that is a complete falsehood. So I think we as physicians have a role to tell our patients that cellulite is really just a normal part of being a woman. Now, in terms of treating cellulite, it's a very challenging entity to treat, and it doesn't need to be treated, but its appearance really does bother a lot of female patients. At this point, topical creams are not terribly effective. Laser at times can have a short period of mild effectiveness, so it's an area that we don't have optimal treatments for at this time. Fat's a different story. We do have effective treatments for fat. Liposuction is a very safe and very effective procedure for fat removal. What's going to change in this field, which is very exciting, is as time goes on, we're going to find new non-invasive ways of removing fat. And I think that's the trend for the future. But what we all need to be careful for, both physicians and patients, is that some of these devices will be effective. They won't be as effective as liposuction, and some of them will not be effective at all. And I think as a physician, it's our responsibility to inform people what is truly effective and what isn't.